This is Sarah Mikesell with the Pig Site, and today we're here with Dr. Paul Sundberg. He is the Executive Director of the Swine Health Information Center. So thanks for being with us again, Paul.
My pleasure. Thanks for having me, Sarah.
Very good. We're here at the Leman Swine Conference and in St. Paul, Minnesota, and you just talked to the group a little bit about some of the ways that the U.S. industry is starting to prepare for ASF should it reach our shores. Can you share a little bit of your message to the group?
Sure. So in 2019, the Swine Health Information Center got a grant from the USDA Foreign Ag Service to go to Vietnam and look at ASF as it's moving around Vietnam real time in an outbreak, and see what lessons we need to learn about ASF in an outbreak should it get to the U.S. and should it become endemic. So this isn't really about the initial response. It's more about what are the tools and what are the information that we need to have in our pockets should ASF get here and USDA says, okay, it's all over now. We're done with trying to respond to it now. Now we've got to go to eradication. So what we did in Vietnam is look at a lot of different priorities, not unlike what we did with PED in the outbreak in 2013. We wanted to learn about transmission. We wanted to learn different techniques about control. We wanted to learn about pathways of entry, about laboratory tools that we could use with ELISAs, for example, to test for antibodies, risk for feed, risk for transportation. All of those things we're trying to learn in Vietnam during a real live outbreak, so we don't have to repeat that, and we can save a lot of time should we get to that spot in the U.S.
Very good. And what are kind of the outcomes that a producer would see or that the industry will see from what you guys are working on right now?
Well, okay, let's start with, I'm hopeful that producers never have to use it.
Right.
They never have to see it. Because like I said, we're going to put things into place that would take USDA policy changes, and that means ASF is endemic. So we're going to keep this in our back pocket and hope we don't have to use it, but we've got the guns there just in case. So for example, one of the things that we've tested in Vietnam was a technique that is commonly known as tooth extraction. And what that amounts to is if you can identify the first sow in a barn with an infection and take her and contact animals out, can you save the rest of the barn? See, that'll take a USDA policy change, because our policy right now is you take the whole barn out.
Right.
But if it becomes endemic, it'll be important to see if we can save the rest of the barn. Bottom line of that is, that's very difficult. It has been successful sometimes, but in our project in Vietnam, it was ahead of us. And in multiple spots, it got out before we identified that first animal. So it was in animals throughout the barn that weren't even identified yet. And so that's some of the things, that we're trying to test on the farm as we go to see if they're viable or not. And maybe not, but how can you improve them to make it viable? And that's the issue about the tooth extraction.
I would think with that, with lots of this, it's going to be heavily about diagnostics, right? And being able to get in there and really be able to identify those sick pigs.
Absolutely, yep. And so there's another piece of the projects, pen-side tests and test on-site, point of contact tests is what they're called. And so we're doing projects that compare pen-side tests for sensitivity and specificity. There's challenges because Vietnam is in the middle of the throes of a COVID epidemic, and that means everything in Vietnam is shut down. So some of this is challenged with getting the reagents into the country, being able to get out in the countryside
Right.
to do these experiments, if you will, to do these projects out on the farm. So there are challenges there, and there have been some delays because of that. But for the most part, all of these are going on. The point of care tests is another important tool that we don't have policy for right now. But should we get into eradication, should we get into making sure we have a cheap, available, reliable way to quickly test a group of animals before they're moved, for example, we're going to have that, and that's part of what we're trying to figure out.
Very good. Lots of components to this, I can see.
There's a lot of balls in the air right now, that's right, and they're being affected. Not only are the balls in the air, but there are a lot of distractions. COVID is certainly the main distraction we've had, so there have been some delays, but these folks are diligent and they're good researchers and they're working hard and they're doing the best they can. We're making progress. It's slower than what I ever wanted it to be,
Right.
but I wanted the answers yesterday,
Right.
but we're going to get them.
Very good. Well, thank you so much for all the information today, Paul.
Thanks, my pleasure.
This is Sarah Mikesell with the Pig Site.